Reading Live. This is me, Vandana PS, joining you from Neethu's Academy. And I'm so sorry for what had happened yesterday because we had some technical glitches on the previous day. Okay, so as usual, we will start with a sample question from part B, then we will move on to part A. So here comes the question. Okay, so welcome back. Have you all done the question? Okay. Yes, Sobi, Anasuya, Reba, Anita, Sudha, Jessica, good afternoon, guys. How was the question? Okay, so this is a sample question from the category 3, which is a memo. Okay, so first of all, we will read the question, then underline the keywords from the question, then we will move on to the options and the paragraph. Okay, so what is the question? This memo outlines the advice for people traveling to PNG about polio boosters and vaccines. What is the risk of the polio outbreak unfurling in Australia? So there is a word which is not familiar to you, that is unfurling. So unfurling, which means spread. Okay, so question is very simple. What is the risk of polio outbreak that is spreading in Australia? In Australia, which means inside Australia. Clear? Okay, so what are the options? When you read a question, always connect with your options, okay? So the first option is, the risk is low because Australia has good border control measures in place. Then, the risk is high because the population is widespread. And option C, the risk is low because Australia has the means to manage cases of polio. Okay, so what are the keywords from the question? So before that, let me know what is a memo. Okay, so I have already told you which is from the third category, and what is a memo? Any idea? Let me know in the comments. What is a memo? Hi Jessica, yes. Dhanalakshmi, yes. Jinu, good afternoon. Okay, so what is a memo? Any idea? Okay, so memo, which means we are sending someone a particular information, okay, and there will be a sender and receiver, and that's not compulsory, okay. So most probably they will mention a sender and a receiver, and memos are a little bit more formal than emails. Okay, so we have different types of memo in this particular module. Okay, advice memo will be there, request memo will be there, reminder or warning memo will be there, confirmation memos will be there. Okay, so here comes another memo, and the memo outlines the advice. So my keywords from the question, which are risk, okay, then polio, unfurling, which is spreading. Okay, so if you want, you can just strike off the first sentence because there is no use. Actually, the question is in the second sentence. What is the risk of a polio outbreak unfurling inside Australia, in Australia? Okay, I'm connecting with my options. So option A is, the risk is low because Australia has good border control measures in place. So my keywords, low, then good border control. Okay, so these are my keywords from the first option. Then, okay, yes, Anasuya, memo, which means purpose. Very good, dear. So actually, what are you reading for in a memo? Suppose I'm asking you a question. Okay, what are you reading for in a memo? So you can say we are reading for the purpose. Clear? So we are reading for the purpose. Okay, so yeah, so these are the keywords from option A. Then from option B, my keywords, it is high, then population, and widespread. And what about option B, C? The risk is low because Australia has the means to manage cases of polio. So my keywords, low, then manage, polio. So these are the keywords from each of the options. Okay, so any idea what is the correct answer? Let me know in the comment box what is your answer. Hi Anub. Yes. Good morning, dear. Yes. Okay, so any idea what is the correct answer here, whether it is A, B or C? Okay, so I'll read the paragraph, then we can decide. Memo, outbreak of circulating vaccine derived polio virus in Papua New Guinea. So the government of this particular area is working with partners including WHO and UNICEF to take appropriate outbreak response measures including contact tracing, testing and vaccination. Polio is very unlikely to spread in Australia because of high rates of vaccine coverage, good sanitation, and the quality and ability of the health system to respond to cases. Then, Australian residents planning to visit PNG for less than 4 weeks should be up to date with their polio vaccination. For adults, this is 3-dose primary course with a booster within the last 10 years. For children, 3-dose primary course with booster at 4 years old is currently recommended. Then these recommended vaccines may be given before arrival in PNG. Okay, then Australian residents traveling to PNG intending to stay for longer than 4 weeks should have a documented polio booster within 4 weeks to 12 months prior to the date of departure from PNG. The booster may be given before arrival in PNG as long as it is given within 4 weeks to 12 months prior to leaving PNG. Okay, so that is all about this paragraph. So any idea how can we eliminate the options and what is your answer? Okay, so in part B, we are applying the strategy that's called elimination method. So what is elimination method? We are just removing 2 options from these 3 options and finding out the correct answer, right? Okay. Okay, and Matthew, Sobi, Dhanalakshmi, Geetu, Jessica, your answer is option A. Why it is option A? Where is it mentioned? Let me know. Where is it mentioned? Option A. The risk is low because Australia has good border control measures in place. Okay, so why it is option A? Any idea? Where is it mentioned? In which paragraph it is mentioned? We have 3 paragraphs here in this particular extract. So where is it mentioned? Okay, so as I've already mentioned, the first sentence of this particular question is not relevant. Okay, actually the question is in the second sentence, which is what is the risk of polio outbreak unfurling in Australia, which means that is spreading inside Australia. First paragraph, the last sentence. Okay, and Matthew, first para, last line. Okay, so first para, last line is polio is very unlikely to spread in Australia because of high rates of vaccine coverage, good sanitation, and the quality and ability of the health system to respond to cases. I agree. Okay, that is your answer. I agree, which is from the first para, the last line. But my doubt is whether it is option A or it is option C. Whether it is option A or option C. So we can first of all eliminate option B because there is no connection with the question, or it is not mentioned. The risk is high because the population is widespread. We can eliminate that particular option because it is not mentioned anywhere in the para, right? Okay, so what about it is whether it is A or B, A or C? C not mentioned, right? The risk is low because Australia has the means to manage cases of polio. So what about this, vaccine coverage, good sanitation, quality and ability? So what is that? Okay, so what about that line? C is not mentioned. If it is not mentioned, then what about the manage cases of polio? So they have some means to manage cases. So what are their means? Okay, so they have high rates of vaccine coverage, good sanitation, and the quality and ability of health system to respond to cases. So what about that one? Yes. Okay, so the A only, right? Why it is option A? Yes, Sonia, good evening, dear. Okay, and Matthew, control measures. Okay, the risk is low because Australia has a good border control measures. Where is it mentioned about border control measures? In the question, they are not asking you regarding what are the border control measures. Okay, they are asking you regarding the spreadness in Australia, unfurling in Australia. So that I'm eliminating option A because it is contradictory option or opposite option because nothing mentioned about the word unfurling. Okay, but as in option C, see, unfurling Australia, which means it is spreading inside Australia, that is polio is very unlikely to spread in Australia because of high rates of vaccine coverage. They have a lot of means to manage cases of polio, and these are the means to manage cases. What are the means to manage cases? It is vaccine coverage, good sanitation, quality and ability, health system to respond to cases. So nothing mentioned about control measures or border control measures in these lines. So answer is option C. Okay, we can eliminate option B as well as option A, right? So answer is option C. The risk is low because Australia has the means. So what are the means? These are the means, okay? To manage cases of polio, unfurling in, which means spreading inside Australia. Okay. Oh, all are wrong, right? No, not all options are wrong. Option C is the correct answer. Okay, dear? Okay. Yeah, so that's all about part B, and I will just summarize everything about part B, okay? In part B, we have 6 questions, okay? And the questions will be in the form of multiple choice questions with 3 answer options. Okay, and what is the strategy we are using here? We are using the strategy that's called elimination method. Okay, so now let's move to part A. Okay, so clear? So we have another new topic here, okay, which is service it is. So how is the material? Was it easy or average or very easy or tough? Yeah, sorry. Was it very tough or average or easy? How was the material? Okay. So let's condense something regarding part A. So what do you guys know about part A? Okay, so what about, today I'll start with the strategy. Okay, usually we will start with the timing and all. So today we will start with the strategy. So what strategy we are using here to complete part A? Okay, Anita, average. Okay, yeah, okay, good. So what about the strategy? Which strategy we are using here? In part B and C, we are using the strategy that is elimination method. So what about in part A? Okay, Anasuya, it was average. Not bad. Okay, Sobi. Then, what about the strategy? Tell me, what is the strategy? Hi, Ashwini. Good afternoon. Okay, Akku, it is skimming and scanning. So yes. So what is skimming? What is the meaning of the word skimming? What is the meaning of the word skimming? I'm not asking you what is skimming, okay? The meaning of the word. Skimming, which means? Skimming. Meaning of the word skimming. So skimming, which means quick, okay, fast, speed. So here we are using the same technique, that is skimming, fast reading, okay, plus scanning is there. So what is scanning? Okay, scanning, which means investigating, or we are searching for some important words from each of the text. Clear? So that is, we are doing this these two strategies together, that is skimming and scanning, which means fast reading, and we are searching for some important keywords from each of the text. Okay, so for that we have 4 different texts in part A. So that is text A, text B, text C and text D. Okay, and these 4 texts will be different from one another, and one of the texts will be a pictorial of something, maybe a table, okay, or a chart, or a diagram, or a graph. Okay, so that's all about this particular text. Then we have 20 questions here in part A. Okay, 20 questions. So what about the time? To complete this 20 questions, you will get 15 minutes, 15. Okay, out of this 60 minutes. Only after the completion of this part A, they will provide you part B and C. Okay, clear? Then this 20 questions, they have categorized into 3 different sections. Okay, 1 to 7 set of questions that can be called match the following questions. Okay, which are match the following questions. Then 8 to 14 set of questions that can be called short answer questions, and the rest of the questions which are, okay, which are called fill in the blanks. So 15 to 20, it is fill in the blanks. Clear? Okay. Okay, Soumya, it is skimming and scanning. Okay, and Matthew, skimming and scanning. Okay, Monisha, skimming and scanning. Anita, yes, skimming and scanning. Okay, Akku, fast reading. That is called skimming. Very good, dear. Okay, Anita, details. Okay, Anna. And Matthew, glance. Yes, in a glance. We are reading it in a glance. Yes. Fast reading, gathering important words. Okay, Ashwini, could you please tell me about 8 to 14 question to answers? Okay, actually 8 to 14 set of questions that can be called short answer questions. Clear? Okay, so let's read these 4 texts and underline the keywords. Let's do, in summary I can say, yeah, in simple words I can say, let's do skimming and scanning. Okay, so what are the keywords from text A? A very small text, right? Okay, very small text. So what are the keywords from text A? Let me know in the comment box, what are your keywords from text A? Okay, so after marking the keywords, then let's move to the questions. So what are the keywords? Cervicitis is an inflammation of cervix the end of the uterus, people can have an acute cervicitis, which is usually caused by infection, or chronic cervicitis, which is usually caused by irritation. People who have multiple partners or who engage in high-risk sexual behavior are at high risk of cervicitis. Those with a history of sexually transmitted infections or STIs, or have partners with a history of STIs, are also more likely to contract cervicitis. But sexual practices are not only the only cause of cervicitis. The condition can be also caused by irritation from douches, tampons, or diaphragms. Cervicitis is very common. It has been estimated that more than half of all adult women, or those AFAB, which means assigned female at birth, will all have cervicitis at some point. Okay, so what are the keywords from this particular text? Very small text, right? Okay, so my keywords, the name of this disease condition, which is cervicitis, then the bracket, okay, then acute, again the bracket I'm marking, then the chronic, as well as again the bracket, okay, then multiple, higher risk, then STIs, okay, then douches, tampons, diaphragms, then common, estimation, half of, AFAB, again the brackets. So these are my keywords from text A. Okay. Okay, so your keywords which are, okay, Soumya, cervicitis, all the brackets. Okay, Anita, bracket, cervicitis, STIs, AFAB. Okay, Reba, heading, subheading, brackets, all italicized and bold letters, all abbreviations, all the names, words indicate time, words indicate experiment, words indicate research, then all the symbols, all the bold letters, first and last line of the sentence. Very good, dear. Very good. Excellent. Okay. Yeah, so these are the keywords from text A. So, like Reba commented, we have some keywords from part A. Okay, so what are the keywords from part A? So, you guys can mark all these headings, all the subheadings, all the numbers. Okay, so no numbers mentioned here. So, yeah, no numbers. All the signs and symbols. Again, no signs and symbols mentioned here. So, very easy. Then fifth one, all the names. So, I have marked all the names, the name of the condition and everything. Okay, sixth one, all the abbreviation, short forms, yes, short forms mentioned. Seventh one, all the brackets. Okay, eighth one, italicized or bold letters or words. Okay, ninth one, the words that indicate time, time related words. Then the words that indicate experiment related words. The words that indicate research related words. Then the first and last line of each and every paragraph, as well as all the bullet points. Okay, so these are the 13 keyword strategy which we are following. Clear? Okay, then what about text B? So what are the keywords from text B? Any idea? Okay, so you guys can mark the heading first, symptoms. So there are there may be no symptoms, maybe, not sure, maybe no symptoms. If symptoms are present, okay, these may include. So these are the symptoms. So it is like just points, okay, I'm just marking all the points. So abnormal vaginal bleeding that occurs after intercourse. So after is a word that indicate time. Or between periods, then unusual vaginal discharge that does not go away. Discharge may be grey, white or yellow in color. Painful sexual intercourse, pain in the vagina, pressure or heaviness in the pelvis, painful urination, vaginal itching. Cervicitis can spread to your uterus, fallopian tubes or ovaries. Then, okay, which is a condition called pelvic inflammatory disease or PID. If you have a PID, you may have abdominal pain or fever. Okay, so these are my keywords from text B. So now we are moving to text C. So here comes a table. Okay, not a table actually, it is a diagram. Yes. Okay, a chart is mentioned here. And this is all about the study. Okay, so this is all about the study. And the numbers mentioned 1327. So I'm marking all the numbers who are eligible and ineligible for this, all the brackets and the signs and symbols. Okay, some percentage and as well as the greater than or equal to signs mentioned here. So all the signs and symbols I'm marking. Okay. Okay. Yeah, so once again. Yes. Okay, some technical glitches, I guess. Yeah, it's fine. So you guys can mark all the numbers once again. Okay. Then I'm moving to text D. It's all about the treatment. So what about the treatment? What are the treatment options mentioned here? Doctors commonly prescribe antibiotics as a treatment for cervicitis. So antibiotics is important, name of the medications. Then these drugs help to clear the infection, which helps to treat symptoms. Acute cervicitis is caused by an infection is best treated medically, as it is essential to clear up the infection. If the woman has chronic cervicitis with mild symptoms, she may choose to use home remedies to help ease the symptoms. Home remedies that may help treat cervicitis include. So what are the home remedies? Traditional Chinese medicine is there. So what is the Chinese medicine? Okay, a 2014 study found that traditional Chinese medical treatments, including specific Chinese herbs, may be effective in the treatment of cervicitis. The herbs were reported to have an inflammatory effect. Eating yogurt, okay, so you also it is important, you can eat a yogurt, eat yogurts, or taking probiotic supplements. Yogurt contains healthful bacteria called probiotics. Probiotics are also available in supplement form and are available to buy online. Okay. Then again, a 2014 study suggests that probiotics may be helpful or may help treat bacterial vaginosis, which is one of the cause of cervicitis. Eating garlic or taking a garlic supplement, then garlic has a strong antibacterial properties. Another 2014 study found that taking garlic supplements may also help treat bacterial vaginosis. Okay, so that is all about my keywords from these different texts. So you guys can take maximum 2 minutes for skimming and scanning. Okay, it will not be easy. Okay, so please do additional materials every day. That is important. Okay. Okay. Okay, Ashwini, 8 to 14 questions. Can we write repeat answers is good. And which type question we need to write repeat answers? Please explain once, ma'am. Okay, okay, dear. I will explain that. Okay, for sure. Okay, so I understood your doubt. Okay, you don't have to repeat any single word from the question into your answer option. Okay, because after this updation of this particular exam, so they have mentioned you don't have to repeat the same word from the question into your answer, unless if it is a name or signs and symbols. Clear? Okay, for example, the question is what neuropathy is mentioned. Okay, so answer is mononeuropathy from the paragraph. So neuropathy is already mentioned in the question, so you guys are thinking, okay, so answer is mono, but your answer is wrong, because mononeuropathy is a name, so you can't separate names. Clear? So you should write mononeuropathy there. If it is a name, you can't separate names. Okay, as well as in the case of signs and symbols. For example, question is asking you regarding what percentage of the population are women. Okay, and in the paragraph the answer is 50% are women. So if you guys are writing 50, your answer is wrong. So you should write 50 and that percentage sign should be there. Clear? Understood? Okay. Yeah. So the first question from 1 to 7, which are match the following questions. Okay. So what is your answer? Let me know. Any idea? First one. If they ask types, which means I didn't understand that. Which type you mean? Okay. So first one, any idea? First question. Okay, so the first question is patients who declined cervicitis etiology study. So very easy question. Yeah, as you know, study which is mentioned in text C. You don't even have to read the text, right? It is from text C, because text C is all about the study. Okay, the eligible categories mentioned, ineligible categories mentioned, so that is all about the study, etiology. Okay, see the first box. It's all about the etiology, so answer is C. Then coming to the second question, second one, the susceptible class of cervicitis. So what about that one? Second question, susceptible class of cervicitis, which means susceptible, very weak, high risk category. Okay, class, which means the group of patients maybe. So susceptible class of cervicitis, which means high risk category of people. Where is it mentioned? High risk group. Any idea? Second question. So high risk category, which is mentioned in text A. See, people who have multiple partners or who engage in high risk sexual behavior are at higher risk of cervicitis. So high risk group, which is mentioned in text A, of course. So that is in text A. Then the third one. So my keywords, I forgot to tell you my keywords. So from the first question, my keyword is etiology and study. From the second question, which are susceptible and class. Okay, so what about the third one? Combined integer of women who got diagnosed with cervicitis. So combined is one my keyword, integer is another keyword, and diagnosis is another keyword. So combined integer, which means that total number of, okay, in simple words I can say the total number of women who got diagnosed with cervicitis. Again, where is this total number of women mentioned? See, 1327 women diagnosed. Okay, so answer is from text C. Then what about the fourth one? Any idea? Fourth question, the conservative approaches to administer the condition. What are the conservative approaches? So what do you mean by the word conservative? Any idea? So my keywords, conservative, approaches, administer. Yeah. So conservative approaches to the condition, to administer the condition. Administer, which means manage the condition. Conservative methods, which I can say the traditional, conventional, natural. Okay, so conservative methods, it is mentioned in the management. So what are the conservative methods? Home remedies or traditional methods. And that is from text D. Okay, so what about fifth one? Any idea? What is your answer, Sobi? Fifth one. Fifth question. Visual confirmation of PID. So my keywords, visual confirmation. So visual confirmation, which means the signs and symptoms, right? Okay, the signs. So what about the signs mentioned? In which text? Visual confirmation of PID. Okay. Yes. So this is all about the confirmation of PID, which is in the last sentence. Yeah. So cervicitis can spread to your uterus, fallopian tubes or ovaries, which is a condition called pelvic inflammatory disease. If you have PID, you may have abdominal fever or pain. Okay, so that is from text D. Okay, first one C, second one A, third one C, fourth one D, fifth one B. So what about the sixth one? The standard rationales of this condition. What about the sixth one? So standard, which I can say the main principle. Okay. And rationales, which means the reasons. What are the causes? So main causes or main reasons. Yeah. So main reasons of this condition. So what are the main reasons? The main reasons of this condition. Where is it mentioned? So from text A, as you can see here, there are a lot of reasons mentioned here. Okay, so because those with a history of sexually transmitted infections, then who have partners with a history of this particular disease condition, okay, they are more likely to have this particular condition. So that is from text A. Okay, then what about seventh one? Any idea? Okay, intake of which supplements can help in treating bacterial vaginosis? The medical or supplements. Okay, supplements can help in treating the condition. So that treatments mentioned in text D. Okay, so that is from text D. So anyone with a 7 out of 7? Okay, 1 to 7 set of questions. Anyone with 7 out of 7? Okay. Okay. Yes. So we are moving to 8 to 14, which are short answer questions. Okay. So what is important here? You can write it in a word or a short phrase. Okay. So maximum 3 words. Name the prescription practiced to medicate the sick in the study group 1 and 2. So from the question, you guys understood that they are asking you regarding the study group. Okay, 1 and 2. Okay, so what about the study group? Study group is mentioned in text C, right? So what about name the prescription? Prescription, which means the name the medicine. Okay, so name of this medicine, practice to medicate, treat, okay, the patient, the sick, which means the patient, right? Okay, so what is the name of the medicine to treat this patients in the study group? What treatment is mentioned there? It is azithromycin, right? Yes, azithromycin is the correct answer, which is mentioned in text C. See this last box. Okay, so you can go with azithromycin. So that is the name of the medicine. Okay, then 9th one, the principal inducement that instigates the severe condition. So my keywords: principal, inducement, instigate. Principal, which means the main. Okay, so what do you mean by inducement? Inducement, which means that reason, okay, that cause, that instigate, what I can say, the reason behind it. Yeah, simply I can say what is the main reason behind the severe condition. So what is the main reason? Okay, so that reason is mentioned here. In severe condition or in chronic cervicitis, the reason is because of irritation. So which is usually caused by irritation. So answer is irritation. Clear? Is that your answer correct? Let me know in the comment box. So what is your answer for this question? 9th one, 8th one, 9th one. What is your answer? Is it irritation? Okay. Then the 10th one. Which is the usually prescribed medication for cervicitis? So usually prescribed medicine. What is the name of the medicine? Usually prescribed, the common medicine used for cervicitis. Any idea? Okay, so the medical or treatment mentioned here. Doctors commonly, typically prescribe antibiotics. So answer is antibiotics from text D. So antibiotics. Yeah. Then 11th one, the part of the uterus that may undergo inflammation due to cervicitis. Okay, Anita, that was from text D. What about 11th question? The part of the uterus that may undergo inflammation due to this condition. Okay, and Matthew, very good dear. It is cervix. Where is it mentioned? Cervix. It is mentioned in text A. Okay, see. It is because of cervix. Cervicitis is an inflammation of the cervix, the end of the uterus, the part of the uterus. Okay, so that is cervix. Okay, so the next question: what effect of Chinese herb may make it an essential treatment option for cervicitis? So, what is the Chinese herb we are using? What effect of Chinese herb may make it an essential treatment option? So that is mentioned in text D as part of the treatment. Okay, so what is the correct answer here? That Chinese herb related answer. Okay, so that is anti-inflammatory. So which is mentioned here. Traditional Chinese medicine, that is according to a 2014 study, found that traditional Chinese medical treatments, including specific Chinese herbs, may be effective in the treatment of this condition. The herbs were reported to have an anti-inflammatory effect. So question is asking you regarding what effect? So anti-inflammatory effect. Okay, so answer is anti-inflammatory effect. Then 13th one. What condition can be expected if cervicitis spreads to your uterus, fallopian tubes or cervicitis? Very easy question. Okay, so either you can write PID or you can write the full form, pelvic inflammatory disease. Okay, so which is from text B, and as you can see here in the last line, cervicitis can spread to your uterus, fallopian tubes and ovaries, which is a condition called pelvic inflammatory disease or PID. Okay. Then, so the 14th one, the common discoloration seen in the vaginal discharge due to cervicitis. So where they've mentioned about the signs. Okay. So what are the common discolorations mentioned? It may be grey, white or yellow. So grey, white or yellow. Okay, so that's all about 14 questions. So now we are moving to 15th one, fill in the blanks. Acute cervicitis that is caused by an dash. Okay, and Matthew, it is grey, white, yellow. Okay, Reshma, grey, white, yellow. So what about 15th one? Caused by an dash is best treated medically. Any idea? 15th question. Hi Sarah, good afternoon dear. Okay, so what about 15th one? Yes, infection is the answer. So where is it mentioned, that particular word infection, that term, that missing word is mentioned in text A. Okay, so people can have acute cervicitis which is usually caused by infection. So answer is infection. Okay, then 16th one. What about 16th one? Okay, Vidya, Reshma, Sajiv and Matthew, it is infection. Yes. Then 16th one. Garlic has strong antibacterial properties. In 2014 study found that taking garlic supplements may also help treat dash. Okay, which is also in D. Where is it mentioned in D? Infection? Yeah, maybe. Okay, that is a common word. Yes, I have seen that word in D also. Yes. So what about 16th one? Garlic has strong antibacterial, and that is from text D, management. Okay, so what about that one? Management. Here it is mentioned acute cervicitis that is caused by an infection. Okay, okay dear, yes. So what about that particular one, 16th one? 16th one, okay, garlic or taking garlic supplements. Okay, so garlic has strong antibacterial properties. Another 2014 study found that taking garlic supplements may also treat bacterial vaginosis. So answer is bacterial vaginosis. Okay, then 17th one. Abnormal dash that occurs after intercourse or between periods is a common symptom of cervicitis. Abnormal what? Okay, so that is from text B. I think it is a sign they're asking you. So abnormal, vaginal bleeding that occurs after intercourse or between periods. So answer is vaginal bleeding. Okay. Okay, and next question, actually it is question number 18. Along with the pain in the vagina, pressure or heaviness in the dash. So pelvis is the answer. Okay, it's not the pelvis, it is pelvis, because the is already mentioned in the question. So answer is pelvis. Okay, and you will get that answer from text B once again. Okay. Yeah, pelvis is the answer. Very good. Yes, Anita, it is pelvis. Yes, pelvis OB. Okay, so that is pressure or heaviness in the pelvis. So answer is pelvis from text B. Okay, then the second last one, I guess. Okay, so along with, the proportion of patients with cervicitis who underwent follow-up was dash. Okay, so that it's all about the study. So I'm just moving towards the study. And what is that answer here? Any idea? Follow-up. Follow-up, it is mentioned here in text C. So 130 with cervicitis followed up, that is 48.9%. Okay, so answer is 48.9%. Yes, Anita, already article is mentioned. Yes, dear. So that you don't have to repeat the same. So our answer is pelvis. Very good. 19th one, which is 48.9% from text C. Then the last one. People who are with a history of dash or who have partners with a history of STIs are also more likely to contract with this particular disease condition, cervicitis. Any idea? 20th one. Okay, so answer is mentioned in text A. Same answer like sexually transmitted infection. So STIs. So answer is sexually transmitted infections. Clear? And that's all about 20 questions. So anyone with 20 out of 20? Okay. I hope you guys marked 20 out of 20, right? Okay, and I'm so happy for that. Anyway, so that's for today. So stay tuned. I'll meet you tomorrow. So take care. God bless you all. Thank you.